if you have suicidal thoughts, you're by definition suicidal. Like having a suicidal thought means you're suicidal, right? And so the two are equated. And yet it's not true for all people. There are many people I've talked to that have these intrusive, distressing images and visions and thoughts of really disturbing things that they recoil in horror from. They don't want to die. And it's more a manifestation of things like sleep deprivation, the mere exposure effect of being exposed to hundreds and hundreds of trauma as a first responder, seeing it all the time. You can't help that the thoughts are going to pop up in your mental landscape. So what happens is if people think that if they have a suicidal thought, they're suicidal, which is what psychology has been telling them for all these years, they lock it in the vault. They don't talk about it because they don't want to be seen as broken or crazy or, altered in some fundamental way. But actually, they're very common for warfighters and first responders.
Hey folks, welcome to another edition of Broken Brains with your host, Bruce Parkman, sponsored by the Mac Parkman Foundation, otherwise known as the official podcast, got to get that right, of the Mac Parkman Foundation, where we look at the issue of repetitive brain trauma from two aspects: repetitive ed impacts from contact sports and repetitive blast exposure from our military veterans in their service, and what these two repetitive conditions are doing to the brains, mental health, well-beings, and futures of our kids, athletes, and veterans. Why is this important? Because the connection between repetitive brain trauma, brain damage, and mental illness is not taught in any nursing, medical, or psychological institution today, leaving you to be at the forefront of the ones that you love, right? So that's why we bring the most amazing guests out, so you have all the information out there so you can make informed decisions and protect the ones that you love and those that you find in the path of life that may be struggling. Today, another amazing guest. Hats off to our producer, Denny Caballo, in the background there. I always think he might come out with a trumpet one day, like the old, was it Johnny Carson, how he used to have his band there. But today, Dr. Shauna, i.e. Doc Springer. Doc Springer is a leading expert on PTSD and transitional trauma, widely recognized for her support and work with military and veterans community. She co-hosts a weekly podcast with the Military Times and is a regular contributor to Psychology Today. Her insights have been featured across major outlets to include CNN, NPR, Forbes, and the Washington Post. She is the author of Fallout, the 10 common beliefs that kill our bravest and the truths that can save them, where she shares powerful lessons from helping warriors navigate and overcome life after service. Doc Springer, thank you so much for coming on the show, man. Really appreciate it.
Thank you, Bruce. Good to be here. Murphy's Law says that immediately my neighbors are going to start using a power saw. So I'm just going to close the window and see if we can get a little better sound.
I've been trying to conquer Murphy for decades, and it's never worked. He's always there. Yeah. I just can't tell you, man. I mean, that cat just keeps showing up. It's just the way
minute
it is.
You go live, right? You do the countdown, and they say now is the time to use power drill.
Yep. Couldn't have done it 10 minutes ago. Right now, we got to do it.
Yeah.
Right. Yeah,
so hopefully that helps a little bit. But
problem.
Happy to be here. There's a lot of things we could talk about. Actually did a lot of work with television production, a show called Veterans Voices of the Bay Area. And I brought on for one of those shows, Dr. Chris Nowinski, who was, he played football with my husband at Harvard. And then we, sort of became friendly and he came on to talk about, he's the head of the Concussion Legacy Foundation. So about concussions in war fighters and in professional sports and the stigma with, kind of saying like, I just got my bell rung and I just, I feel altered. So lots of places we could take this conversation.
I know Chris very well. As a matter of fact, it was his organization that got my son's brain to Harvard, where he's now with the Boston University CTE Bank. And this is how I got involved in this whole environment of brain repair and repetitive brain trauma. He was a sports player, and he died at the age of 17.
I'm sorry to hear it. I've also shared with some families Chris's name, and he's taking care of that process of doing the autopsy of the brain with some Marines who have died by suicide and treated them like family. He's somebody I trust to really just honor that and in the best possible way honor the people who have died. And so I'm really sorry to hear that you've been through that.
Yeah, it's well, and Chris is good people. I mean, the Concussion
Yeah.
Legacy Foundation has absolutely the best hotline in the country. We
Mm.
recommend, anybody that's struggling or has kids or loved ones that are dealing with issues to contact them to find localized care. And he's been on this show, and we talk. I used to be on his board, and that's just one of the parts that we need to really get into, because you talk about strength.
Mhm.
You've dealt with veterans, for the most part, and really want to dial into the issue of repetitive brain trauma
Okay.
and the lack of care right now that our veterans are getting. And right now, from a therapy perspective, there's a lot of therapy going on. There's therapy that's out there, but our veterans are being completely misdiagnosed when it comes to the causality of those cognitive, behavioral, and psychological problems, which is
Mhm.
they have a brain injury. They're not just having combat,
Yeah.
observed combat, seen dead bodies, or childhood trauma, whatever it is. And
Sure.
I'd love to just start with, just diving right in.
Sure.
Where are you, seeing these veterans, and then what can we do to address some of the gaps in care? As I want to dive into your past, how you got into this. I mean, I do.
Sure.
You got an amazing story.
Yeah. Okay. So I would say I'm a psychologist, first of all,
Okay.
but I'm come at this differently than a lot of people in my field because I have long partnered with medical providers, physicians, actually trained some of them when they were in their residency many years ago, and have partnered with, through Stellar Mental Health, several really top tier physicians. And so my model has never been what was inculcated in me in graduate school, which is you're the expert and you have therapies to offer that can really help people. What I have really been advancing is yes, therapy is important, but it's so much more powerful if we first treat the biological injuries and then we do the therapy. Like, you wouldn't do physical therapy if somebody broke their knee. You would do the surgery, you'd repair the fundamental injury, and then you do the physical therapy. So I very much believe in therapy, but when you treat biological injuries and don't miss those, to your point, then the outcomes you get are better, they're faster, they're more compassionate. So I do think, unfortunately, a lot has kind of stayed the same in terms of what's considered best practice. And I have been one of the most vocal psychologists on the side of saying, we don't own our patients. We have to collaborate with other providers to get people the best outcomes. And if that means doing innovative biological treatments as part of the treatment plan, that's what we need to be doing.
And that's absolutely what we need to be doing. And we're missing the mark right now, not on therapy. I mean, the psychologists, we do have, we'll talk about a little bit about psychology and veterans here in a
We're
second.
missing the mark on that too. It's okay.
Yeah,
We
we
can
are to
say
a
that.
certain point,
The,
but
yeah, the
yeah,
single most thing I hear from people is there's not enough culturally competent docs. So
culturally competent or maybe culturally relational to a military veteran's service that I think
attuned
those
and
are the complaints I hear a
yeah,
lot out there.
same, same. So I'm not sensitive about, you know, criticisms of the therapy model. Like, we can talk about all of that if you want.
And it's not so much to criticize the model. It's to it's more about how do we start addressing these gaps that we know are
Yeah.
decades old. We've known that I mean we as a society, as a culture, as medics and doctors and nurses and psychologists are
Yeah.
just finding out about repetitive blast exposure. But we've known for years that there's got to be a biological something biological there that we missed. But and on the therapy side, we do have gaps in what we'd say, the ability to relate to veterans.
Yeah.
And I don't know how to fix that. I mean, there's psychologists like you, Doc, that we come across that have these unbelievable reputations. Like, she gets me, she understands me, she's working with my team to get me off drugs and all this stuff. Why is this not scalable? Why can't we, why can't we fix this?
Some of it can be trained, and some of it is because people need to understand that this work requires a call on you. It's a calling, not a job, and requires its own kind of warrior spirit. Different kind than perhaps you would have, you're a sergeant major, so sort of combat operations and training. It's a different kind of warrior spirit, but people that have a warrior spirit recognize each other very quickly. And I define a warrior as someone who does things others can't or won't do in the service of values they hold sacred. So you have to have that relentless drive. You have to want to test yourself. You want to keep improving. You have to be values driven, mission driven, willing to make sacrifices, willing to be brave and go against the flow when necessary to protect and support your patients, because that's who this is really about. And I think a lot of times, first, you were talking about how a lot of brain injury related content isn't trained in grad school. A lot of what people need to know to support warriors is not trained in grad school. I did a course recently with, it was on tpn.health. It's a free resource. I did it with my friend, Dr. Robin Saunier, who's a doc. And the course was called Good Intentions, Bad Outcomes: Why Veterans and First Responders Drop Out of Care with Otherwise Skilled Providers. And I think the reason is because a lot of people that have great therapy skills are trying to just migrate those skills to these populations, and they don't deeply understand the culture, values, and ethos of those they're serving. And the people they're serving recognize that gap. It's invisible, but they pick up on it in a nanosecond. And so some of it can be trained, and some of it is just who you are, unfortunately.
And brings up some good, you bring up many good points, because first of all, it has to be a calling. I mean, it's
Yeah.
what I love about psychologists, and my daughter's a nurse practitioner of psychiatric medicine
Mhm.
and managed care. And she spends her life just trying to get kids and people off drugs, right? Not on them, which is, there's a lot easier to put people on drugs nowadays than it is to get them off,
Yeah,
well, you well know.
sure.
But this service to others, which is I find appealing and I find amazing. And psychologists are doing that. They're improving lives, and it has to be through care, and it has to be through passion. Um, and what aspect of that can we train people in, so
Yeah.
that then when they meet a veteran, they meet a first responder? I mean, you don't have to swear and start guzzling beer. I mean, but there is that shared compassion, that
Yeah.
ethos, as you say, and then maybe just comes from just respecting this other side of society and how they have to do their jobs. I mean, I don't know where we
They
start.
can be trained. They absolutely can be trained, Bruce. So I think of them as like sleeper docs. Like there's a difference between doctors and docs, and there's a lot more sleeper docs out there that if they knew that you need specialized training, you need to go through certain experiences and get exposure, certain ideas and concepts, you could be trained up to really build and hold trust. There could be more docs. One of the programs that I'm partnered with right now is called Fortitude Recovery, or Summit Estate is another name. Now, Summit Estate kind of serves a more affluent Silicon Valley population around substance dependence. Fortitude Recovery is serving first responders and veterans. So they brought me in and they said, we want you to make sure you train up our team. And there's a lot of people in there that are like docs by nature. And so the first thing I did is I gave them a 100 question assessment of, what they understand. Like this was, all right, you got to speak the language. If you go into a different culture, you have to not, lose a beat
Amen.
when
Yeah.
you got to do the work. So do you understand their language? And it's mostly acronyms, right? Some of the funny things that they'll say, some of the important things that have meaning that they'll say. Can you do that? And then do you understand their value system? Do you understand how to respond in these clinical scenarios? I'm going to give you 4 options. Pick the best one if you're a doc. So it's detailed and lengthy. And I had them pick a code name, like a call sign, essentially, to kind of get them acquainted with some of that. And I'm like, usually call signs are given to you. You don't pick them. But for this one, I don't want you to feel vulnerable. I really want you to just pick this call sign, gives you privacy and anonymity, and then just give me your best answer. And then let's look at how much that person with that call sign changed after my training. And so I wanted to look at progress and growth and how they integrate this different way of thinking and this different approach. But a lot of them are mission driven, and they were able to really, that team was really able to perform and learn and integrate a new way of thinking. So a lot of it can be trained if you have the right people.
Well, I mean, I'd like to get that model scaled because I mean and I
Scalable.
don't, and it should be right. I mean, it's just that what when I go to the VA, they always ask me, "Am I feeling safe?" and all this. I'm like, "Yeah, I think my 100-pound wife is getting ready to hurt." I just mess with them a little bit, but
Yeah.
the care is there. They are trying so hard, yet we still have such
Yeah.
huge gaps. We're over medicating our vets. We are, not empathizing with them, and they're and we're losing so many of them. And it's not.
Yeah.
It's a combination of a multitude of issues. And I want to get to the largest one, which I feel right now is the inattention to the issue of brain damage.
Hmm.
And I have been on the US SOCOM brain health team. I have
Hmm.
experienced this personally in my life, and I had to
Yes.
put myself back together. Um,
Yes.
I watched this with a wide variety of my friends, and here we are now, years after
Yeah.
we started the wars that I think are responsible for this. We could dive into that, but we're
Hmm.
just finding what we are just finding out now that
Yeah.
years ago that we should have known that this was coming. Yet whether it's repetitive blast exposure and more importantly repetitive head impacts, none of these correlations are taught in our psychology courses. So our suicide prevention specialists, our
Hmm.
psychologists, are completely unaware. And
Hmm.
this affects not on the sports side. We're talking millions of Americans that
Hmm.
have been impacted, that have a
Yeah.
biological cause to their mental illness, or a biological component, let's say that, to their mental illness.
Hmm.
So, I mean, and you're nodding your head, and so how do we get to this? Because it's a huge gap in knowledge, right? And to your point, 100% of psychologists can be trained on this, that this
Yeah.
fact
Yeah.
exists. And
Yeah.
I'm very interested in what kind of model could be used to scale that knowledge, because so
Yeah.
desperately needed.
Reading between the lines there, Bruce, I think we're probably both weary of how often we are not left of boom with things that ought to be so obvious. But I want to kind of frame this in a positive light as well
Oh, there's a
because
lot of
it's
hope.
important. It's
Yep,
important.
a lot of hope.
We used to think that the brain was something that if something died in the brain, it was dead. It was necrotic tissue, and that was the end of it, and you just lost that faculty. What people like Chris Nowinski and others that have done, brain research and really quality research have shown is that there is neuroplasticity in the brain. The brain has the ability to some degree, to adapt and retrain. And as well, our technologies have really made leaps and bounds in terms of what we can see on a brain scan. So one of the things I've often said in the past several years is um, we now know that what we called post-traumatic stress disorder, based on advances in neuroscience, is an injury. And if you have the right brain scan, you can see it on a brain scan. And if you have the right treatment, it can be healed to a large degree. So right now, just to sort of uh, tell everybody how that's happening, there's a big study going on, a $3.5 million study. NYU is running this study, and they are looking with pre and post fMRI brain scans, very expensive scans, so hard to scale that, but it's kind of a landmark study that's really looking at if you have post-traumatic stress injury, it alters the fight or flight system, and you can see it if you have the right brain scan. And they're getting the stellate ganglion block, which you've, I'm sure, heard of. We
And
do a
have
lot of
had.
stellate ganglion
Yeah.
blocks, and we also have the soft protocol actually, because that was something we developed when a lot of operators were coming in with operator syndrome. And so it's a combination of stellate ganglion block as the first step, kind of primer to the paint, of then ketamine infusions. and therapy for integration. So those are the three elements. It would be get the body back to calm control, and then the plasticity that ketamine can facilitate, and then the integration work that you still need to do to change the underlying patterns and identity pieces. Those three are really just changing the game entirely. So I don't want people to hear, oh, I've been injured in a way that makes me fundamentally broken. I know that's the title of your podcast, so I'm trying to be careful, but I believe that what's available now allows us to kind of heal in many cases.
Absolutely. And I want
Okay,
to
good. I'm
reiterate what you
glad. Great.
said. The amount of hope that's out there.
Yeah.
I mean, that's why we wrote research. That's why I just rewrote this whole book for parents, because of
Okay.
all the knowledge that we have out there. That doesn't mean because your brain's damaged, you're gone, right? It's
Yes.
the end of the world. There's so much we can
Yes.
do. The problem is it's not getting done. We keep
Yeah.
talking about it. We research about it.
Mm.
I mean, Chris Nowinski is part of the CTE community that has looked at the issue of CTE since 2009, and not one study has ever been done on children. And now,
Mm.
and this is a common thread in my podcast and it's not Chris, it's not Ann, it's not
Yeah. Yeah.
Dr. Cantu, it's not all the great people that I have met over the years. It's the fact that as a community, we have
Yeah.
focused on NFL players and grown men and high school players, and have completely ignored the impact of these same sports on a brain that is developing. And this is how my son was killed. And this is how thousands and thousands of children die a year with no closure, because we have an untrained coroner community as well as an untrained psychological, medical, and doctor, so that they just are, these kids leave. And we have the same problem with our veterans, because our entire care communities, if you get away from the polytrauma clinics, the NICOs, the home safes of this world, and
Yeah.
the soft, you talked about soft, right?
Yeah.
I'm a soft guy. We have all the resources.
You get stuff
Okay.
nobody else gets. That's true.
Nobody else has
Yeah.
access to. And is that
Yeah.
fair when our conventional forces,
Yeah.
they have the same problem? So we're talking about
Yeah.
the fact that the knowledge exists. What you just mentioned, that program, when
Yeah.
I first fell apart, the initial approach was stellate ganglion blocks in conjunction with ketamine for a period of 1 week.
You had that protocol?
I've had it. I've had that
Oh.
protocol. Amazing. I went to Chicago, Dr. Eugene
That's
Lipov.
my chief medical, officer
Okay.
at Stellate.
Yep. So I did
Yeah.
my stellate ganglion blocks, 3 ketamine treatments. Then I came back here to
Mhm.
Tampa, did 3 more the following week.
Okay.
And
Yep.
I did ketamine for about a year
Mm.
until I then moved up the chain to ayahuasca. And then I just completed ibogaine. It's not that I need, now I'm a researcher. I actually go through psychedelic experiences because I need to walk the walk. When I talk about them, I've been there.
Yeah.
I've done that. And so now my wife actually calls me Bruce 4.0. We can talk about the entire spiritual side of these psychedelics and what they do to you as a human being. But
So
I think
growth and plasticity. It's your story.
that what
Bruce
ketamine does,
4.0.
that window of neuroplasticity is
Yeah.
the first time that
Yeah.
a lot of people that are suffering get some relief. Can you explain, that protocol right there, I think is a game changer
Yeah.
for you, and you partner that with brain supplementation, anything to get the brain balanced
Yeah.
chemically, hormonally, the whole thing. And you've
Yeah.
got a starting point right there that can absolutely change anybody that's been impacted
Yeah.
by either our repetitive head impacts or repetitive blast exposure.
Yeah. I mean, at the exposure of hawking my friend Chris a little too much, I think his stuff needs to get more out there. One of the things that was hopeful is that we have kids that play soccer. And now to sign up for soccer, we were required to watch a number of videos on concussions. And here comes Chris Nowinski onto the screen talking about concussions. I had to watch this as a parent, and I was like, I know him. And it was about what to notice and what happens if somebody gets their bell rung, in more clinical terms of what you should do to give their brain a rest and take them out of the game and certain indicators and things like that. But that's pretty recent to your point. It wasn't, I think, happening even 5 years ago.
No,
So
ma'am.
you're right. There's a whole generation of kids where all that education is not on board.
And here's the other point that we're pushing right now. Concussions aren't the problem. All right, concussions concussions are part of life. They happen, right? The risk that a concussion will have, it's when repetitive impacts are intentional, like they are part of the sport. The damage that they do over time to underdeveloped brains is not part of any concussion training protocol in this country at this time. The impact of repetitive impacts has yet, here in Florida, we're pushing hard. Football state, got some work to do, right? But the impact of these soccer balls and checking and tackling, women's rugby, fastest growing sport in America. You know, when I sat down with my psychiatrist, because if you lose a kid, man, you're going to see a shrink. I sat there and I was writing this book, right? And she's like, and I started explaining her why my son was here, and she was horrified. She goes, Bruce, I send 100% of my kids out to the sports because it means so much to them. I had no clue that it could have been the same. He said, these kids have been playing football since they were 6 years old. No wonder they're in high school with major mood disorders. She goes, oh my God. She goes, we are completely untrained. And she started crying. And so, you know, because she goes, I am part of this problem in my ignorance, right? Nobody harms a child on
nobody
purpose.
Intends to.
And so that's part of the problem. All of our parents, like if you go to the Google store and you download our HeadSmart app, it's got repetitive in it, it's got concussions. Concussions are they don't help, tell you that. But the issue of repetitive impact still has to make it. And it is the root cause of CTE. It is the root cause of major neurological disorders that come in after life. I've got rugby friends now with Parkinson's, ALS, right? That played massive amounts of rugby in their youth, right? When you take RHI away, you get it out of practice. You delay exposure till high school.
RHI, repetitive head
impacts. Yep, repetitive head impacts. You take that out.
That really reminds me of trauma and how, like, we're evolving the model of trauma, right? Because for many years, it was post-traumatic stress is an event that causes helplessness or horror that shatters your perception of safety or how much, you know, you're safe or other people can be trusted, right?
Right.
Well, for many people that you and I know, the warfighter community, the first responder community, just the athlete community, all of them, it's not one event or one concussion, right? It's a cumulative impact. So my work around trauma is like a mirror image of what you're telling me that I'm learning here about TBI, and it tracks for me that it's cumulative impact that we need to pay more attention to, not just that one thing where somebody's dizzy and they, you know, pay attention to that too. But it's very interesting. I like to learn things from people. Thank you.
Yeah, no, well, and Doc, and that's what we're getting to is like we got all these frontline people that are dealing with these folks completely unaware right now that, man, you know, I need to ask these questions. And Chris has put out there's a new there's a traumatic encephalopathy syndrome protocols, and we can go into that at another time. But 4 simple questions that any parent can ask. Do you have a mental illness? Oh, first, do you have exposure? 5 years of contact sports, 2 years in high school? Or do you have a history of blast exposure because you're a tanker, EOD, spec ops, whatever? And do you have a mental illness? Is it progressing? And the third one, the last one is, do you have a genetic predisposition or family history? If the last one's no, first 3 are yes, the probability of a biologically induced mental illness is through the roof. Go get your brain scan. You mentioned fMRI, right? Get fMRI, exposure, fMRI, neurologist. We validate that we've got a problem. And now the treatment plan is part of your plan. That whole integration, ketamine, you know, and getting the fMRI and getting the stellate ganglion blocks. We have now taken brain health to a whole new level.
TMS too, right? Deserves some mention. Transcranial magnetic stimulation is another technology that I've seen be very effective. And they're always innovating in terms of the delivery model. The delivery model is getting shorter and shorter because it used to be you had to do, you know, many sessions, like 30 or 40 sessions.
Oh,
and
really?
now the delivery model is like really condensed. And so it fits into people's lives. So there's a lot.
HBOT. I mean,
HBOT is another,
But how do you get 40 dives and all, you know, and I didn't even know every hospital's got an HBOT in it. I did not know that, right? But they're used for burn victims and not, and wound injuries, I guess, and not for, you know.
Well, some of the more innovative programs too, like Fortitude that I'm working with, they have an HBOT machine. They do sort of like that biological, psychological like model, right? So you
Okay.
could be in their program as a first responder or veteran and basically get a whole sequence of HBOT free as part of the program. So, it's coming, but not fast enough
It's
when you've
not.
suffered, when you've
So
suffered
let's talk
cyber
about
attacks.
psychedelics. You mentioned ketamine,
Okay.
all right? And
Yeah.
I've done quite a bit of ketamine, and I
Yeah.
consider
You
it the
started.
gateway psychedelic. That's
Yeah.
how I describe it, right? Gateway
Yeah.
psychedelic.
Mm.
And for those that are out there, we all know that that these psychedelics are not a lot of fun. They are hard work, especially when
Yeah.
you got personal trauma and
Yeah.
issues, baggage that you got to overcome. But they're remarkably useful in getting where sometimes therapy can't crack those doors open. But yet, the combination of psychedelic therapy and integration, the kind of work that you're doing, Doc, I think is game changing. And again, we're talking about something that there's not enough being done right now. Talk to us about that and how they play off each other. How does the ketamine, the impact on the brain, help with stress that leads to better therapy outcomes or therapeutic outcomes? Talk to us about that because a
Mhm.
lot of
Yeah.
psychologists don't practice this or are unaware that it's really useful or whatever it is.
No, because our model's been stagnant of, just these best practice talk therapies for so long. So I started out kind of like skeptical because that's part of being a doc, right? Is like you want to protect your patients. So you don't just go, oh, let's try this. Um, Ketamine, when I was getting trained in what ketamine is, it is a polite medication compared to some of the things that you've experienced. Ayahuasca and ibogaine, much less polite. Um, yeah,
Yeah.
but I mean, I still, right, had to overcome some initial installation of like values and training and really kind of get to a place where I saw this as a medicine that probably people have been on. They just don't know it because ketamine is used all the time as part of general anesthesia and surgeries because it's
Mhm.
so safe and has such a safe, side effect profile for surgeries. It's an anesthesia. But you just don't know it because you're out. So giving a certain dose, not as a street drug, but in a medically responsible way in a medically supervised setting, I favor IV personally because it's 100% bioavailable and you can stop it. So if people go down two pathways, right? The pathway of productive suffering, let it go. Let them suffer if it's productive. Unproductive suffering, you can stop it if they have an IV. With the other administration methods, you can't. And to me, that's compelling. But yeah, ketamine, I think it increases neuroplasticity. It helps parts of your brain that don't normally talk to each other to talk to each other. And when supported by really culturally attuned, again, it's got to be culturally attuned integration therapy, it's a game changer. So I started sort of like seeing that happen with my patients. And then when I was doing patient care for Stella, which I recently stopped doing, but I helped build that integration program. So they had me seeing patients, as part of get in the trenches and see some people and then build from there. So the patients I was seeing are getting better in 4 to 6 sessions. It was very accelerated to the point where I can't go back, Bruce, to doing therapy as usual. It would be frustrating for me
That
because
much of
it
a
would be
change.
so slow
Wow.
and so ineffective compared to the outcomes I was getting with the combination of ketamine and culturally attuned, trauma informed therapy. So that I noticed. And then I was part of a film, a good film, called Warrior's Journey. Kyle Bergquist is the filmmaker. Roger Sparks is in the film, other, warriors of note that people respect in the community were part of this film Warrior's Journey. And I think it's just coming out now, but they went down to Costa Rica and had, I think it was ayahuasca retreats. And I talked about moral injury and how these psychedelic medicines are really good at getting after things like survivor guilt, grief, and moral injury through specific ways that they operate and kind of things they open up and how they can help you to process in the most adaptive way possible. And at the same time, I have to say, this is part of my warrior spirit, I have also gotten the calls when things have gone sideways, when things were not done in a medically responsible way, were not done in a way that protected people. And we're way too loosey-goosey and a bunch of gurus in a room that went through one psychedelic journey. They thought they were an expert, and they're in there with no doctor in the room for things that could happen medically. And then it's this whole shaman-based model without that other piece of looking out for people, that I think expertise matters here. And so doing these really promising treatments in a way that's, medically safe and supported matters to me. And that's the balance I try to hold is responsible innovation. So yes, innovate like lives depend on it because they do, but do it in a way that protects your patient's safety. That's where I'm trying to find my core.
No, and I think that you're right. I mean, I've been to several ketamine clinics here in Florida should be out of business. I mean, it was
Yeah.
just horrible, their approach, their treatment, and because I've been through it at the highest level, I'm like, and I was just looking to continue my treatment. I had to find a place, I don't like people in the room with me because I know you're there and it takes me out of my experience and I'm not going to go as deep as I want. I'm not going to talk out loud. I don't mind you having the camera and the blood pressure medicine on me. Got it? I'm that guy, right?
Yeah,
But,
sure. Yeah.
but in my
A lot
journey,
of
I went
people
through
are. Yeah.
several clinics and in order to
Mm,
find the right one. And to your point,
yeah.
there is a modicum of care and these clinics have to be vetted in terms of expertise and
Yeah.
there has to be a model. I agree. A clinical model that's approved that they have to follow in order to be able to prescribe these medications to include having a culturally attuned
Yeah.
integrative network that either refers them or they refer the patients, to the therapist.
Because you know what can happen. It goes beyond it not being effective and being a waste of people's time. Psychedelics, I've observed, tend to attract a certain kind of person that really wants to be a guru and they want to have that power over people sometimes. And so you want to be careful about, putting yourself in the hands of a team that is trustworthy and that is really there for you to heal, not because they want to feel like they're the savior that took you through it.
That you are
Does
absolutely
that
right.
track?
And yeah, the veteran communities are usually run by veterans. They have a shaman, there's a veteran, there's always a medic on staff. And with a lot of the more advanced psychedelics, the only thing you really are in danger from is if you're on SSRIs when you take them,
Uh-huh.
especially ayahuasca or ibogaine, there's some over the reactions. So they're
Mhm.
there in case, the few, but
Yeah.
people need to be talked to, and
Yeah.
so on and so forth. But I absolutely agree
Yeah.
that I have yet to encounter, but I have been a part of veteran retreats
Mm.
at locations where I absolutely believe there was this shamanic guru that was the gift of, oh man,
Yeah.
it's like, no, no, this is,
Yeah.
I do believe to my heart, these are God's medicines. He created the plants that created these medicines. And if they're administered with respect and care for both, the user, the patient,
Mm.
right, and the practitioner, then nothing but good can come out of these experiences, even if it's not good
Mhm.
for the individual. And to your point, I mean, when you talk about moral injury, I have personally been there when men who have
Yeah.
had to kill children
Yeah.
in the course of their duty because the
Yeah.
kid's coming up, they don't know if they have an IED
Yep.
vest, they're getting closer, they don't know how to speak Arab, they know how to speak English, they're pointing the
Yeah.
gun. They had to make decisions. And in
Yep.
every one of these instances, those children and the men and women that they had to do their job came back to them and forgave them and
Yeah.
understood that, hey, or I was trying to kill you. I'm sorry. The
Mm.
children came back, and in every one of
Mm.
these instances that I have been about, these men and women were able to leave with a
Mm.
a profoundly less impact from the more. I mean, they had
That's what I'm
hope.
talking about.
Yep,
People can come up and finish that jagged edge in your life, whether
absolutely.
it's grief, whether it's moral injury. That's what I talked about in the movie. So I am supportive of innovation as long as it's done responsibly. And what you said about you believe they're God's medicine is a bit of a twist on something kind of similar that I wrote about on Psychology Today, and it was around just observing the guruism and narcissism of people that really want to be saviors, and they tend to be attracted to be, in these roles. And really people of faith thinking that this is a street drug, ketamine, and it's something that's, not for them because it's used in this way in clubs, right? So I
Right.
wrote this article after grappling with this myself. How do I make sense of this? Ketamine is not God was the
That one
title
is
of my
not. Yes,
article.
ma'am. That is.
And my point is that if you're a person of faith, that if you take a medicine like ketamine, it is a psychedelic in the sense of, right, delic means to reveal, and psyche is psyche. So
Okay.
it's a medicine that reveals the psyche. It will reveal your faith, and God and your faith will be in that experience. And so it isn't inconsistent with God. God's going to be part of that experience and kind of trying to help people of faith understand, don't exclude yourself from one of the most powerful medicines that doesn't counteract your faith, that actually could deepen and enhance your faith
Oh,
if done in the right way by someone who's not trying to replace that God with a different kind of philosophy. And so that's why I really think the shamanism, the guruism, I'm not saying that there can't be guides. I've seen a spectrum of people. I think we both know what we're talking about here,
yeah.
where you want the people that take care of you to be docs who are not about themselves, but about how their mission is to help you to heal and just facilitate that. That's where I
And
think power is.
couldn't agree more. And I will honestly say, and I am a very devout man, uh, psychedelics and the experiences I've had have only revealed God's wonder even more. And I am
Yeah.
closer to God than ever. Like I'm 100% in. And it was all about, just ripping myself apart and understanding that at the core, we are good
Mm,
people and we've made mistakes. We have to deal. And when we own them,
mm,
then we have real and we learn to love ourselves in spite of our mistakes.
mm,
The power that comes from that is
mhm,
is just is just amazing. And to your point, yes, I mean, there absolutely has to be some degree of professionalism. I've been invited to go on ayahuasca, ceremonies in the middle of the jungle and all. I got it, man. I mean, if that's what you want, you can do that. And for people of faith, as you talk, I mean, my wife's a yoga instructor. There are actually Christians out there that see yoga, in
yeah.
spite of its benefits to the body, as being some other, satanic religion, and they will not take yoga. And she actually teaches a class called Holy Yoga. it's 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 crazy. I mean, not crazy, but it's where our beliefs and
Yeah.
the Lord created all these things for us to improve ourselves to get through life, and our faith sometimes just kind of gets in the way. But you know, quick question: how did you end up getting into assisting the veteran community? What was there an event or? I mean,
Mm.
did you just decide that, I mean, you're dealing with Dr. Lipov, you're talking about the soft model, which, I mean, that's an amazing protocol. I haven't heard that yet, so I'm definitely want to dig into that.
Yeah.
But,
He published a couple of papers, one with Chris Free on operator syndrome, and then
yeah, Chris
one
been on the
on the
show.
soft model case study that, might be good resources. And he asked me to be the chief psychologist for Stella when we in 2020 co-founded that. So
Okay.
I
Did
met
not know.
him I met him through I was doing a television program called Veterans Voices, and I had been working with the Stellate Ganglion block in the last 6 months of my VA 8-year tour of duty, just worried about some of my patients. One of the special forces medics asked me to get it for him. I was in the room and it really changed their lives and saved some of their lives, frankly. So I came on the show to talk about the SGB, and then I said we should do a follow-up show and find out, who's really innovating in this space. So we brought on Eugene Libov and Dr. Brian McLean from Tripler Army Medical Center. I think he's even still active duty working
Okay.
on the Army base in Hawaii, and he's done probably thousands of these at this point. So two people that have published a lot, done this a lot, really, innovators in the space. And after the show, um, Dr. Lubov said that was a good experience and thank you. And I would like to treat one person of your choice. And I was like, great, I've got this Marine sniper I'm really worried about, and sent this guy to Chicago, and it had a really positive outcome. So for 3 years, I was not getting paid. It was not my job. But people would find me and just say, I haven't found another doc that I can really connect with. Or my patients would say, I'm not okay. and I would just, ask for money to support them and then send them to Chicago. And after doing this long enough, there was a really brave group of investors that said, we want to help you guys launch this. And we launched it in 2020, like 3 weeks before the pandemic. And so this is, as you know, something that requires face to face. I mean, it's like you're like as close as your dentist is to you, right? To do this. So this is a really bad time for launching something that requires such close contact. But the investors said, there's never been a better time or a more important time to get it right when it comes to trauma. So we just need you guys to get it right. And so in that first year, I wrote a 35-page white paper reviewing all the research. I did 250 media engagements to try to get the word out. I wrote a review paper eventually on it in a journal, and just did a ton of stuff. Did a podcast on Military Times. People still have not heard of it. It's not for lack of trying. It's just, it's, I think, an indictment of how, to your point, people in special forces get things everybody else doesn't even know about. And that gap between the civilian and military culture and healthcare system is profoundly deep. And people often don't even hear about it until years after lives have been saved and changed
Or
in
lost.
military warfighter circles.
So
So
can you explain? A lot of people don't know what a stellate ganglion block is. It's funny because I went
yeah,
through my first one during COVID, and I caught COVID after they did one side, and I never completed it. So I had to come back months later and get both sides done because Dr. Lipov wanted a I don't know.
interesting.
Yeah. So
Yeah.
yeah, I got the test came back. But anyways, talk to our audience because a lot of them have never heard of this. What is the
I know
the
you're not
procedure
saying
all
you got
about?
it from us, right?
What's that?
I know you're not saying you got the
Oh
COVID
no,
from
I
us.
had COVID coming
Yeah.
in, but the tests
Yeah.
you had to take a
Just to
test and
be
then
clear,
yeah, no.
we were
No.
all like doing tests every day, all the
I
time.
got one side
Um,
done, but no,
I
talk to
remember
us
coming
about
to
stellate.
Chicago,
Yeah.
and but I wonder, actually, the stellate ganglion block actually shows that it could help with long COVID syndrome. I wonder if that still wasn't helpful to you in some way, because who knows,
Yeah.
speculation here, but it really can help with the loss of taste and smell for a lot of people that get COVID. So
Ah,
it
okay.
couldn't have been a bad thing. Um, so what was your question, Bruce?
So explain to the audience what a stellate
Oh,
ganglion block
sure,
is, and
sure. It's
the yeah.
yeah, easy. It's a minimally invasive injection using a small needle. I've had it done myself. Um, Typically, about here and here is how we do it. We do an advanced form of the stellate ganglion block. A typical stellate ganglion block is one injection, and you might have gotten that at the time, but we've really advanced the protocol to 2 injections at 2 levels on the neck. And what we're injecting is typically ropivacaine or bupivacaine. It's an anesthetic. It's not anything psychoactive. So this is totally different than our conversation about ketamine, ayahuasca, ibogaine, all of that. It's just like Novocaine at the dentist. And it bathes the nerves in numbing agent. And then when the nerves kind of come back online, it restores calm and control to the body. It kind of brings you back to calm and control.
And that's all has to do with the fight or flight mechanism
Mhm. Yep.
within the body. Okay, because
It has
with
to do with, like, when you're in fight or flight all the time, you can't switch um, flip the switch off. Sometimes you just get stuck there, like really profoundly stuck there. And so it basically all the nerves are kind of freaking out, and you know, um, they are often shooting out new nerve fibers to handle the increased allostatic load on the body, and the stellate ganglion block through the process of pruning nerves brings you back to baseline. So you
okay.
could be calm again.
I tell guys, if you're combat parking your car and you can't sit in a restaurant unless your back's to a wall and you're looking at the door, you
Uh,
probably need a stellate ganglion block. That's how
I,
I explain to
well,
them.
the good thing is, if people live in Illinois, the 100 Club of Illinois pays for the stellate ganglion block for any first responder in the state of Illinois, just covers it.
Wow.
The Illinois Department of Veterans Affairs has started funding stellate ganglion blocks for veterans in the state of Illinois. And when you can, you have a FSA or HSA, health savings account,
Hmm.
flex spending account. Often that could be used to cover the cost of the treatment. And so we have about 20 clinics in the US. And so this isn't some esoteric thing where you have to, fly to Timbuktu
Right.
and get this in one place. We're kind of all over. So,
Do you have one in Florida?
oh yeah. Yeah.
Oh, then we need to talk because we
Yeah.
tried to replace, we're doing ketamine and brain supplementation programs, free for veterans right now through a
Yeah.
grant, and we wanted to replace the ketamine with SGB to get another
Oh,
modality in there, but we couldn't link up with a clinic to go ahead and
I
so
can make a partnership happen in less than a day.
okay,
Yeah.
good. All right, we'll
I'm
then
pretty
we'll
sure we're still in Florida.
okay.
But because, there's a lot of military folks in Florida and,
Uh, we got
so
the I
just
think the
just, get with me and I'll make that happen.
yeah, I
And
think we
I'm
got the
happy to forge partnerships for other people that are listening too, because, when an organization pays for people, we can give kind of a special price to the organization. If an individual comes to us, we have to bill their insurance. But if an organization is covering them, we don't bill the
is
organization more than the organizational cost. So,
is insurance covering this?
not yet. No,
Yeah.
we'll get there, but insurance always lags behind innovation. I think the NYU study, the big VA study, we're probably about 3 years out. Um, it's about $2,000 to $3,000 for everything, both treatments, both sides, 2 days at a clinic, in that range at Stella, which is actually below what you'll find in a lot of markets. It's not the stuff we do where there's not big margins on it. We're
Mm,
like really kind of doing that one for impact. So our pricing's really reasonable, and
yeah.
people can reach out to me and I can get partnerships started to give, organizational pricing as well.
That'd be great. And for those that
Yeah.
are interested, if you're listening, that's not 2 days spent in the clinic. You go in the morning and you're
No.
out, a couple, 3 hours later. I mean, you're not
Yeah.
there all day, and so somebody has to drive
Sure.
you, but, oh,
It
that's
takes about
amazing.
15 to 20 minutes, but we have people there for, to your point, about 3 hours
Yeah,
each day.
okay, yeah, yeah, it's,
Yeah.
no, that's amazing, doc, definitely wanna talk to you about that and get
Sure.
that going. So, one of the things I'd like to talk about is your book on fallout, right?
Oh
The
yeah.
10
Thanks.
common beliefs that kill our bravest. So, let's talk about that and the truths that could save them. What's that book's all about? And please tell us about the common beliefs that are just really, I mean, that they're killing our people, man. What's the book all about?
Yeah. So this came out of my general just cumulative trauma of getting all of the suicide notifications. I'm not saying I know all of these men and women, but they're protectors and defenders, and people identify me as the lady that works with suicide prevention in the warfighter community. There are others. I'm not the only person, but I get a lot of these now for first responders too. An officer, you know, died by suicide, and there's things that we could do. We've had a number of false beliefs, I believe, that have taken us all in the wrong direction for decades. Essentially migrating what works for civilians into this community doesn't work. And that's really what I see when I pull back the veil on what are we doing now? It's stuff that doesn't work for this community, and I can understand why it doesn't. And so this book really tackles 10 common beliefs. They're not the only 10. Of course, Murphy's Law. I write this book, I publish it, and not a week goes by and I go, "Ooh, I forgot that one.
There's
There's
11.
another one," right? Of course. So I'll tell you, you'd be the first to know. Tomorrow, there's a firefighter magazine called Crackle that's
Okay.
publishing an article that's kind of like, I wish I had put it in my book because this is another one. Um, it's that if you have suicidal thoughts, it doesn't necessarily mean that you're suicidal.
Mm. Yeah.
So, conventional psychology and what I was trained is if you have suicidal thoughts, you're by definition suicidal. Like having a suicidal thought means you're suicidal, right? And so the two are equated. And yet it's not true for all people. There
No.
are many people I've talked to that have these intrusive, distressing images and visions and thoughts of really disturbing things that they recoil in horror from. They don't want to die. And it's more a manifestation of things like sleep deprivation, the mere exposure effect of being exposed to hundreds and hundreds of traumas as a first responder, seeing it all the time, you can't help that the thoughts are going to pop up in your mental landscape. So what happens is if people think that if they have a suicidal thought, they're suicidal, which is what psychology has been telling them for all these years, they lock it in the vault. They don't talk about it because they don't want to be seen as broken or crazy or, altered in some fundamental way. But actually, they're very common for warfighters and first responders. How could it be otherwise? So I've been saying mental warfare is part of the path of choosing to follow this calling of being a protector or defender. We have to understand this. We have to protect people to prepare them for this mental warfare. That's what my work does. That's where my work sits. And we have to change the model to these are not random people that are having this really unusual experience. This is everybody at some point or another. And having that kind of thought is not the same thing as saying you're suicidal.
I'm
Some
gonna
are,
kill myself.
but not everybody. Does that track?
Yeah,
What do you
it
think?
does. I mean, trust me, since my son's left, there's been many a day where I don't want to be here. Yeah, I want to be with
Yeah.
him. I'm not going to take my life. I just miss him. I'm sad. And, and I just, I had a bad night last night where I just woke up, blaming myself, whatever. And then it's not true. But as a dad, it's just hard to just live without the love of your life, and that's just the
Yeah.
way, that's where I am, is where God has me. And I'll see him again. So I'm not worried about it. I just got to get there. Until then, this is, part of the call. But what you're saying right now is absolutely, as I've dealt with integration, because like every time I do, another form of psychedelic, I end up getting deeper into myself and unraveling things that sometimes you just don't want to see that have been there for a long time. And now you got to deal with it. It's like, oh my God, but that's healthy, right? It's healthy.
Yeah.
And that's what people need. If you have those thoughts, there are absolutely healthy ways. There's a reason for them. You're not crazy. And then working with folks like you, Doc Springer, they can unravel these issues and resolve them where they just don't exist anymore. Finding them is half the battle, or just admitting they're there, right? It's
Yeah. I mean, agree. My alarm went off, which means that I have to jump on with a warrior who's expecting me, but I want to leave you with this
no.
thought. The time flew by today. Um, in my book, Warrior, the one before this one,
Okay.
I've been in closed circles of warfighters and off the grid places, and I ask them, what do the voices of your demons tell you? That voice of despair, right? That voice of what called you last night, right? What do they tell you? And I think there's power to be gained in understanding that the campaigns of the voice of despair, if we're talking about mental warfare, it's pretty predictable. And for a lot of men, it's an attack on their fatherhood, that they couldn't protect their child, that they are, there's guilt, huge guilt on that protector ability as a father and blame around that. So many of the warfighters, that was one of the 4 or 5 things that came up all the time.
Hmm.
And so I would just offer to you that that's it, when you can predict something and it's not just you, this is the shape of the mental warfare. You know what
Okay.
you're dealing with, and then you can get traction on it in a different way than going to that place, even for a half step of, is this true? Is this really about me? Instead, knowing, no, this is predictable. It's going to come at me in one of these ways, and that was one of the major ways that it came at people.
Yeah, well, I'm diving into it, and thanks. You can send me the bill when after we get off the phone for working with me.
It's like $15 to buy the book. That's the bill. And then 12 for Fallout. Yeah, if anybody tells you they make money on books, they're lying. Like
Oh, dude, I know,
it's
man. We
not
give
why
ours
you write
away.
books. Yeah, not.
Ours is for free. Well, Doc Springer, I know you have to go, man. We'd love to
Yeah.
have you come back in the show. This has been amazing. We will both continue our journeys. If you see
Yes.
Dr. Lipoff, we'd love to have him come on the show. Denny's been trying to get him on for a while.
Oh, I
And
can ask him.
talk
Yeah.
about stellate ganglion blocks.
Sure.
You have an amazing impact on our future. If you want to give a quick goodbye and tell people where to find you and where to find the books, then go ahead and sign off. We'll take it from there. And we
Sure.
really appreciate you coming on the show.
Thank you for having me. Best place to find me is Doc Shauna Springer, DOCSHAUNA Springer, SPRINGER.com. My books are on Amazon. I have 4 right now. One is a 400-page book on military transition, what we don't focus on, the
Oh,
identity-related psychological dimensions, relational dimension of transition from the military. That was with Jason Roncaroni. And then I wrote Warrior. And then I collaborated with Michael Segru, wrote his story in his voice and then in my voice in Relentless Courage to kind of talk about first responder trauma. And then my latest one is called Fallout: 10 Common Beliefs That Kill Our Bravest and the Truths That Can Save Them. So if you want to support me, the best way to do it is read the work. I want to have impact, and then write a review on Amazon. That would be the most helpful way to support this and make it visible for people who need it.
We'll push them out. We'd love to have you at our summit in September on repetitive brain trauma and talk about the gaps in psychology and how to fix them for sure.
Thank you for the invite.
All right. Thank you, ma'am. You take care of yourself.
Cool.
God bless.
Take care. All right.
All right. Well, folks, another amazing edition of Broken Brains, man. What a good, we're having the best times ever on this show, and really appreciate your support. So you like us, please subscribe to us, encourage your friends. We're approaching, getting a little bit over almost 1.3, a little bit over 1,000, trying to get to that 2,000 mark. So please help us spread the word and get us some more subscribers, because the information that we have on these shows is not found in any other podcast on the internet right now. And people need to know this. So don't forget, you got children, go to the website, free book, download it. The new book, revised book, should be uploaded here by the end of next month. Get the app on Google and Apple Store. Head Smart. Summit's coming up 16th and 17th September. You're going to see that all over the internet too. And finally, your children only have one brain. Please, you don't want to be in my shoes. Take care of them. And so until the next episode of Broken Brains, thank you all. God bless. Talk to you later.